Good afternoon.
Yeah, thank you so much for being here. And thank you so much for supporting the chamber in such a wonderful way with the executive circles. We just launched that program. Gives you some additional visibility, but it really gives us the ability to talk about our businesses in the community. So thank you for that. So tell me about what is Holly Springs Direct Primary Care?
Great question. I love talking about it, obviously. So this is a medical office that I've had open for almost 2 years now. And the entire concept is just doing better for patients. I came from a larger system. And with that, like any big system, it's just about a lot of folks going in and out. You're busy, we're rushed. And I didn't like practicing medicine that way. And so with direct primary care, we don't accept insurance for our services. We still work with insurance to some degree, but that allows us to have less patients to take care of, so we can spend more time with them and just practice better medicine. Whatever we think should happen without, succumbing to the insurance world of what has to happen.
Yeah. So what's the difference between this model and concierge doctor's offices? Because there's a difference between the two.
Yeah, there is a definite difference. And most people don't know this. So concierge medicine, with those offices, they still take insurance, but patients have to pay some kind of fee just to be a part of the practice. Whereas with our office, it's truly direct primary care. So we don't take insurance at all for our services. And so patients are paying a set, fixed monthly rate just for all access to our office and our care. So it's much more affordable as well. Concierge medicine can be very expensive.
Well, I think that probably really plays into people know what to expect and how they're going to pay for it, right? So you go to a doctor's office, oftentimes they're like, yeah, you're going to need this, this, and this, and you have no idea how much it's going to cost. And then this is kind of those set pricing and people know what to expect. What happens when you have a patient that comes in that maybe needs something that you can't have? What are your referral partners like here in the community? What do you do in those situations?
So thankfully, I've been in the area for a while at my prior, larger system job. So I still have all those connections, and I developed even thankfully more just without taking insurance. I've had to reach out to get creative ways. How do I solve problems and get people the help that they need? So I can still refer to anybody that I would have otherwise, and patients can still use insurance for referrals and medicines and imaging studies, and I can still order all those things just like always. But it's nice just to be able to network with people, again, to do what's right for the patient. That's, I think, the big summary of why I created the office and why I like it so much.
I love that because I think oftentimes people get mixed in the system. One of the things that people have from you, right, is that they talk to you directly. They talk to their practitioner. So, I go to the doctor and then I get, blood work, and then I don't hear back from the doctor. I hear back from a nurse or somebody else, a pathologist, somebody like that. Is that different or is that the same for you?
It's very different. So that's part of the direct primary care is patients have a direct relationship with us. And there's much less obstacles, just less things messing up the communication. And so patients, they text us directly, or they can email us directly, or we can talk on the phone with them just directly. Because we have fewer patients to take care of, we can spend more time doing what's right, for them. And that opens up, to some other advantages like same or next day appointments, which is hard to do in the typical larger system.
Mm-hmm.
And we have much longer appointments than the typical system would have. So 1 hour long appointments for new patients, for example.
Wow.
Which is not really possible in the insurance world because they have to see so many people to cover that overhead. Well, for us, our overhead is really low because we don't have to mess with insurance. Mm-hmm. So we can spend that time, those resources, and direct it towards patients, which is how medicine is supposed to be, in the first place.
It reminds me back when you watch old TV shows and stuff, and you think about the doctor that comes to your house and they sit and I think those longer appointment times, I'm sure that probably gives you some insight into what's happening behind the scenes. If someone presents a symptom, sometimes it's not the symptom, there's something else, and it allows you to kind of weave into those investigative.
Yep, absolutely. It's called old school medicine. Some people use that term for this kind of office.
I didn't know that, by the way, before I said that.
And I have done some home visits. I don't advertise that to the public, but it's good to know. Like I'll do whatever is necessary, to help patients. And it's just again, kind of the backbone of why we're doing this.
Yeah. So it's very patient centered, and it's really there for the patient.
Absolutely.
And you are expanding, right? Because you started this. I remember your ribbon cutting. We were really excited, and it was just you. But this has been so well received by the community. I think during a perfect time where insurance rates have gone up significantly. You're expanding your team, though. Tell us more
absolutely.
about that.
So thankfully, the community really enjoys this model and this, how it's so different than the typical office. So I was by myself for a few months. And then thankfully, we were growing nicely. And so I added a medical assistant. And then since then, I've added another medical assistant because we've had a second provider join. And we have another provider, which will be our third total, that will join in July. We've also added a phlebotomist just this week. Just, again, the whole goal is to do more for patients. How can we add value to the office? And so, again, the goal is just to really do what's right for patients, whatever that really looks like. And thankfully, growth is going well, and I'm so thankful for the community, just supporting us and realizing the benefits of the office.
Awesome. And you are located in downtown Holly Springs, but people will come all over for this kind of service too. So you've got this beautiful new spot on Raleigh Street in downtown Holly Springs. So people can grab lunch and they come over and see you, and an easy walking distance. Yeah. Anything else that you want to share?
I think I always tell people that most of our patients actually have insurance. They just value the benefits of the office. And so really our office can benefit, I think, almost every single person out there, whether you have insurance, the longer appointments, the easier communication, direct access. Without insurance, we can get healthcare done more affordably. The young population, the older population, we essentially see it all. And so that's what I would kind of just reinforce is just, I think most people would benefit from at least learning about the office. And even if we're not the right fit, there's other DPC offices out there that maybe they would find would fit their life better. But the whole goal, again, not to hammer it too much, but it is kind of on purpose too, is just to do what's right for patients and just practice medicine the way it should be practiced.
Awesome. We love it. Well, thank you so much for bringing this new idea to Holly Springs, and congratulations on all the success.
Thank you. I appreciate it.
Awesome.